and start. Continue. Go.
Hi everyone, so it's our 5:30 Friday night update and I'm really pleased to tell you about what we've done and who we've invited so far, because we actually exceeded our thoughts of what we could do and the decisions that we've made that actually progress that further. So I'm going to show my screen to you now with some numbers, and I know people are quite keen from the other meetings that we've had to find out a kind of current position. So let me just share my screen with you. Hang on a minute, can you see my table now? My producer should be showing it. I'm just waiting for him to tell me that it's on the screen. Don't know what's happening. Can you keep your thumbs? I can't tell, your hands are moving, but I can't tell. Okay, it's fine. So you should be able to see this Word document in front of you. Okay, so what we've done is break down, okay, the number of people in each cohort and who we have invited so far and who we are going to vaccinate. So next week or whenever we next meet, we'll be able to tell you who got which vaccine when. So you can see that, as we promised last week when we spoke on Friday, that we had invited every single person over the age of 80. That is 717 people in total. That number has substantially reduced, and that saddens me to say that, where people have passed. But that's the number that we have, and we were able to vaccinate everybody. But as we knew, there were going to be some people who are housebound, those people that are isolated, self-isolating, those people that sadly do have COVID as well because of that. So actually, we're aware that we had a number of people that weren't able to attend to be able to. So we invited another group of people, and now we started off with only those people aged 79. And I know last week there was somebody that asked that when they would be invited, because they were 79 currently and turning 80 in 6 weeks. Well, hopefully you've now had your letter that's invited you to attend tomorrow or Sunday. And we were also able to extend that to those patients who were aged, or who are aged, 78. So that's where you can see that a further 223 letters went out to patients to invite them for this weekend, to be able to invite them in and see what happens in terms of that. So we are really pleased to be able to say that we've been able to invite all of our patients aged 78 and over. So that's all of cohort 1 and 38% of cohort 2. Now, we have now had confirmation that our next lot of Pfizer vaccine is coming next week. So we're able to run clinics on Friday, the 23rd of January, and Saturday, the 24th of January. So in preparation for this, we have sent letters to all of those patients left in cohort 2. So that's 75 to 77, and the other patients in cohort 2 who are clinically extremely vulnerable, that I've written CEV. And there are a total of 529 patients in our group. So actually we've been able to invite all of them. So we're on track, we've done really well, okay, that by next weekend, end of next weekend, we should have vaccinated all of our patients in cohort 1 and all of our patients in cohort 2. Now we are expecting that some people in cohort 2 aren't either going to want their vaccine, are housebound, or indeed are isolating or have COVID, etc. So we anticipate inviting those people who have missed their appointment in cohort 1 to be able to come next weekend as well. However, we just need to wait for the numbers, which we expect to hear on Monday or Tuesday, about how and who we vaccinated this weekend and who therefore needs to be invited in on the 23rd and 24th of January. So watch this space. We haven't forgotten about you if indeed you aren't able to come this weekend and at age 78 and over. We will re-invite you, so please do not worry, we will be in touch. Now, we've had a slight hiccup with our AstraZeneca vaccine, and that is we haven't been given all the supplies that we need, and therefore we'd hope to vaccinate some of our patients who are housebound next week. That may be delayed slightly, but we're doing our best to resolve it. It was to do with the delivery outside of our control completely, but we've done our best to resolve it as best, as much as we can. So moving on from that, what you can see are our numbers of patients in cohort 3, which is age 70 to 74, and indeed our age of cohort 3 is 70 to 74, and cohort 4 is 65 to 69. So we are on track to vaccinate everybody pretty quickly. We do not know as yet when our vaccine is coming after the delivery on the 21st of January, so we have to wait and see, but we're very hopeful it will be the following week. So you know, we can only do what we can when we get notified that the delivery is coming. However, we are ready and able to vaccinate as we need to when the vaccine comes in. We've been working really well with the military. So they will be a lot of their vaccinators will be vaccinating during the weekend of the 23rd and 24th of January, because it's important we work together as NHS and Defence. They need to learn how to do this as well. They'll be under our guidance, we'll be working together. So that should be a good positive community effort as one. Now, when we next meet as well, I do hope to be able to give you the numbers of those people that have had Pfizer and those people that have had to have AstraZeneca, but of course at the moment it will be, I expect it to be 0 for AstraZeneca due to the supply issue. Okay, so I'm just going to now flick through to my questions to see if there are any questions about this particular data before we move on any further. So I think I've answered Anthony's question about what the position is. Okay, so in terms of that, Neil's asked in terms of how we work it out. Well, you can see our numbers are such that we're working really hard to actually invite everybody in a particular cohort at a time. And that's great, because actually we don't need to pick anybody. But when we go into the next cohort, if we have additional capacity, then we go by age. Okay. So I think, again, Peter Kaminsky has asked which vaccines we have received. Okay, indeed, like I've said, we've got the Pfizer vaccine and we've got a supply issue with the AstraZeneca, but importantly, we have only booked appointments for Pfizer this weekend, so we are full steam ahead. So somebody else has asked about being 78 and their husband being 76. Well, therefore, I would hope to vaccinate him in the next group after the 23rd, 24th of January. Okay, fingers crossed. To be able to do that. So actually, no, so he should be in back. So actually, no, so I'm really sorry. Your husband, who's 76, should have received a vaccine letter inviting him to attend on the 23rd or 24th. So if you haven't received that letter by Tuesday, please let us know. What do you class as vulnerable? That is those people who were shielding, clinically extremely vulnerable. There's lots of clinical information about who are clinically extremely vulnerable. So please, if you can Google it, that's the better way, as I don't have any clinicians with me tonight. So let me move on to those. So a friend involved in vaccinating 1,200 people this week. At the very last minute, the vaccine was sent elsewhere. All I can say is it hasn't happened to us. We are ready to go for tomorrow. What vaccination are cohort 2 receiving? As I've already said, it's Pfizer, to be able to do that. Clinically extremely vulnerable are those people who have been coded as clinically extremely vulnerable by the government, and the government have told us. So if the government haven't told us, then we may have made an exceptional decision to add you to that list, and we would then inform the government, but most of those people have been identified by the government nationally. The post is in a muddle. I'm CEV but haven't had an invite. Can you also send by text to be safe? The letters only went out yesterday, okay? So yesterday evening. I doubt that they're with you yet, okay? So as we did last time with the over 80s and asked you to contact us from Thursday onwards if you hadn't received a letter, please can you do that this time, but actually contact us on Tuesday. So if you are in cohort 2, so that's those people who are aged 75 to 77 for us, because the older group have already been invited, or indeed clinically extremely vulnerable, please contact us on Tuesday if you have not received a letter. Well, yep, so I think hopefully I've done the last one. When were they posted? They were posted last night. So they should be received any time between tomorrow and Monday. Therefore, if you have not heard by Tuesday, please let me know. Okay, so I can't answer any particular questions about allergies. However, the current guidelines that we have is that Pfizer is okay for anybody who hasn't had an allergic reaction to the contents of Pfizer, multiple drugs or unexplained anaphylactic shock. So penicillin is not a reason to not have the vaccine, if I've said that right. I think so. Okay, to be able to do that. Now, some people have said, are you sending out invitations prior to being supplied with the vaccines? Yes, we are. The reason being is that the vaccine has a 120-hour expiry date. Okay, so we have 3.5 days to vaccinate 1,000 people, 975 people. We cannot wait until the vaccine actually arrives to contact you. So we go in good faith that that vaccine is going to arrive as promised by NHS England, and I'm pleased to say that absolutely they said that the vaccine would arrive today, and indeed it has, so we are ready to go for tomorrow. Now there's another, let me just go down. Would the shielding people be together or mixed with people who have not been shielding? So the important thing here is that cohort 2 includes people aged 75 to 77 and those people that are shielding. Now remember, everybody over the age of 70 was advised to isolate, weren't they? So in terms of that, I very much hope that they've been following the government guidelines. They are following the lockdown rules and therefore have not been socialising outside of their household and therefore shouldn't pose any additional risk to those people, anybody else, whether or not they're shielding or not. Okay, so when you say contact us if you've not received a letter, how do we contact you? Where do we contact you? So contact us via our website or indeed phone us. I would advise that you contact us by the website if you can. It's quicker, you don't have to wait in the queue, and we are extremely busy looking after people who are poorly. We have a lot of patients who have COVID-19 symptoms who are very unwell. Okay, we have a lot of demand for our services, more so than we did in March and April and May. We didn't think it could get busier than that, but it has. So please, if you can use the website, that's better. Let me carry on going down. So somebody said in terms of, do you have any idea how long before a 63-year-old will be vaccinated? The 63-year-olds are in cohort 5. The government have promised the nation that people in cohort 1 to 4 will be vaccinated by the end of February. Therefore, I do not know when cohort 5 will be invited to attend. I'm really sorry, I just don't know that. Now, somebody asked, John Johnson's asked a question about the effectiveness of the vaccine. Please, I'm not a clinician. My doctors are either getting used to finding out more about this vaccine that's just been arrived, or indeed are seeing patients. So I'm so sorry, I can't answer that one at the moment, okay? And I'm just going to go back up because there was a question about where are the vaccines being given. So let's recap on what the arrangements are for the delivery of the COVID vaccine programme. Now remember, we had to choose one site and only one site to deliver this vaccine from. We have to choose a suitable site for vaccinating as many people as possible whilst keeping people in the waiting room for 15 minutes post-vaccine. So our only building that is large enough and suitable for this delivery at any moment in time is Lark Hill Medical Centre. It's along Willoughby Road, and we're going to show you a map in a bit about where that is. But I'd like to talk you through the flow, so I'm going to change my screen to something else so I can show you the map. Let me get this up. Okay, so you should be able to now see the map on our screen that is the building of Lark Hill, where you'll be coming. So this building is used by Sarum Health Group. It's called Salisbury Plain Health Centre, and normally you'd be coming through station 7, where currently it says patient exit. That is normally the nice big doors that you walk through and to be greeted by reception. But for our COVID vaccine programme, actually you're going to be going to the right-hand side of the building through to the entrance on the left, which is indeed a fire door. Now you'll be greeted by some volunteers, and we'll talk more about volunteers in a little while. Annette asked if you're well enough today, have your temperature taken, and then you'll move through into the check-in area, which we call as 2A, Station 2A, where you'll be, your appointment will be marked as you've arrived, and you'll be registered onto an IT system called Pinnacle, which is the IT system used to record the vaccine across the nation. Once that's happened, you'll move into Station 3, be greeted by a volunteer who will direct you to one of the boom signs that we've put down, which is one of the chairs where you will be vaccinated. So you'll be sat kind of in the doorway. Now, please remember, wear a short sleeve top. We don't really have time for you to take off multiple layers of clothes while sat with the vaccinator, okay? Because they need to concentrate on giving you all the information and checking various different aspects of your health to ensure that the vaccine is appropriate to give to you at the time of your appointment. But once you've had your appointment, you're going to be given a kitchen timer, a little immunisation card to confirm that you've had the vaccine today, and you'll be asked to sit in the waiting room. So you'll leave your boom chair, let's call it that, move to Station 5 through to the big arrow in the middle of the map and wait in the waiting room. Now we have 30 chairs there for you that they're appropriately socially distanced to be able to do that, and you'll be watching a video that will recap on what you've been told today, on the time of your vaccine, about the side effects, the resuming normal activities, things like that. And after 15 minutes, you'll be asked that obviously confirm that you can leave, and you'll go through the exit and back out to your car. There are numerous volunteers at Station 1, 3, 5, 6 and 7. So you have various volunteers and there, and also we've got volunteers that are helping the vaccinators to record the information on Pinnacle, the data system, to confirm that you've had the vaccine at the time of your appointment. So hopefully that's clear. And again, I'm just going to go and recap on the questions to make sure that I've shared that together. Let's have a look. So hopefully that's where you know what's happening with the vaccine. Now I would like to recap on the map. So I'm just going to ask my producer Stuart if he can show the Google map. Is he doing that? Stuart, can you tell me that the map's up? Brilliant. Okay, so this is the map that we also showed last week, whereby you can see that where the centre is. So you drive away from Durrington towards Shrewton, and you obviously drive through Lark Hill. So you drive through Lark Hill, and I don't like that picture. Can you take that picture off, please, Stuart? Down the Packway, past the primary school on your left, through and past shops that are on your right, including the Nisa. Keep going down, okay, and you have to turn left down Willoughby Road. So it's just going to zoom in down Willoughby Road, okay? And down Willoughby Road, there is a huge new building. Now, our producer just showed you the old building, okay? That is not the building you're going to, so please don't go there. Please don't attend that place. And if you do, if you see that place, no, it's the wrong bit to be. It's only next door, but it's the brand new spanking building that we have. And the military have been very kind and put up additional signs to guide you to where you're going tomorrow and Sunday. So hopefully you'll find us without a problem. And there are spaces for about 300 cars. So bearing in mind that we're vaccinating 10 people an hour, in terms of that, we are hoping that obviously there'll be enough people through to be able to do that. It's not 10 people an hour, it's 60 people an hour. 60 people an hour. I'm getting all my numbers worked up. It's been a very, very long 2 weeks, but 60 people an hour. So on that basis, there should be ample car parking. Now, just to make sure, please arrive at the time of your appointment. Now, we do know that some people will take a little longer to get to us, do that, but don't worry, if most people arrive exactly at the time of their appointment, not early, not late, then we should be able to accommodate anybody that takes a little bit of an extra time to be able to get to us. But please don't come early because you'll just be stood outside, and I think it's supposed to rain tomorrow. And if you come early and the rain's really bad, we will have to ask you to go back to your cars and wait until your time. That's not ideal. So if anything, wait in your car rather than come to us and wait outside. I just don't want you to be freezing cold and wet. Okay, so please come at the right time. So I'm just going to again look at the questions to be able to do that. So yes, now there's a really good one in terms of if people don't turn up, what are we doing? So if we have any vaccine left at the end of the day, there's two things that we're doing. As people DNA, we will be telephoning people, and indeed I've got staff on stations working to contact people that missed their appointment to try and get them in. However, there's also that regard that actually there may be some people that turn up that just can't have that vaccine, so we'll have to return at another time. Now, if we are left with any vaccine at the end, okay, I do have NHS employers and military employers on standby who we will be contacting to be able to invite them in to attend for an appointment last minute on Sunday. So I have roughly 100 people on standby to be able to come in, and they are all frontline health and social care workers or indeed from the military. Okay, so it will happen in terms of that, and those people in the military are those who are working frontline as well to be able to do that. Okay, so that's our backup for that for this weekend. It may change for another weekend, but for this weekend, that's our position. Now, there's a good question here. When we've had the first vaccine, will we be told when we will receive the second? Well, as you know from our other chats, we're currently being told that it's 10 weeks' time. You will be given consent to be revaccinated within the next 12 weeks. I think that gives the NHS supply chain some flexibility if need be, but locally, the CCG have decided that we will be revaccinating you at 10 weeks. And indeed, our video at the end confirms that for this weekend, you will be returning on the 27th of March and the 28th of March, and we will be sending letters. So please don't contact us to book an appointment. Again, we will be contacting you to say to you when your appointment is for that weekend, but please be prepared that you will be invited in on the 27th and 28th of March if you have the vaccine tomorrow or Sunday. Okay, let's have another look at the questions. Okay. Somebody's asked a question, Stuart, about not a question, but to access all the car parks, it is better to come in via Wilson Road. Yes, that is better to be able to do that. So go ahead and do that. That's no problem at all. Yeah, so we will be contacting people if we need to, if we have any vaccine left. We will not waste a drop. Now, there are some other questions that I can see whereby they've said they've just been told that they are clinically extremely vulnerable and have only just been told that, as in yesterday. Of course, if your medical records have been updated that you are clinically extremely vulnerable, then a letter would have been sent. If indeed your medical records haven't, then indeed you will not have received a letter because we don't know that you've been informed that you are clinically extremely vulnerable. So you have to bear with us with that. We can only use the information that we have. But like I've said, if you haven't been invited by Tuesday, haven't received a letter by Tuesday, please contact us and we will look to resolve that. Okay, because the likelihood is you have an appointment, you just don't know the time, and we can fix that. And of course, that's the best way in terms of using the website, that we can just reply to you with the website. Now, my producer's just put his hand up. I have no idea why. So, Stuart, what do you need from me? I don't know what he's doing. I'm really sorry. Okay, he's got a picture of the building. Well done, Stuart. So this is what he wants to show you, to say this is the building, okay, of Salisbury Plain Health Centre. So you can see it's huge. It's really big. So please follow this building and go up the steps, up towards the traditional front door. But remember, you'll be walking round to the right. Please do not walk round as other people have done yesterday when they were coming to have a look round, gone up and round on the other side of the path and actually ended up in the bushes. Now, indeed, I did find a lady in the bushes. She'll know who she is. And I say that with a smile, because it was really funny seeing a lady in the bushes trying to work out where the fire exit was. So please walk up the stairs, up those steps that you can see, and Stuart's just pointing at them now. There will be volunteers there who will guide you round by the windows, so on the far side of that wall, round to the side of the building, and the fire exit will be there. So, and there'll be 3 volunteers waiting. Okay, so that's the side of the building. Brilliant. Well done, Stuart. Thank you for that. Okay, let me just see this. So, so let's have a look. How will pharmacies fit into the equation? I don't really understand what that question means as to how they fit into the equation. If you're meaning that do we vaccinate their staff, if they are frontline staff, then yes, they fulfil that criteria, and yes, we will vaccinate them. Does one get vaccine based on medical records or just age? So the government have set those plans, okay? They have set the cohorts. They're based predominantly on age, but they have brought forward certain groups and they have allocated those. We follow those rules. Now, we are lucky for the size that we are, that we don't have to pick out of a particular age cohort or group who is going to be invited. Okay, so we are really nice and clear that we are inviting more people than we've got in our cohorts, so because actually we can vaccinate. So that's a really good news story. Okay. So I'm just going to go through my list, check that I've done all these things, see today, flow, car parking. Right, so next thing, most important, and I don't think I stress this enough, and that is everybody must wear a face mask. If somebody arrives and hasn't got a face mask on, we will be asking them to wear a face shield. Now, there are obviously medical exemptions, and we are aware of those, but if you can wear a mask, that'd be so much better. Not only is it better for everybody else around, but most importantly, it keeps you safe. It keeps you safer than without. And there'll be a lot of people around, and although we'll be wearing PPE, just be aware that there is still a risk. We can't avoid that. Okay, so please take all measures that are possible. And also tomorrow at about 11 o'clock, there'll be a lady called Helen with us, and she will be taking photos, talking with patients who are around, and hopefully taking pictures from that. And she works for the CCG, so she'll be putting that into the pack of information that is being distributed by NHS England. Okay, so that's good news. But last of all, the other thing to talk to you about is volunteers. Now, we work out that we need roughly 76, I say roughly because I think next week we might need a few more, volunteers to run these clinics. So it's roughly 20 people per clinic, because we do one in the morning, one in the afternoon each day. So we need 20 people to help us from stewarding. So that's advising people to go back to the car park, where the entrances are, guiding people through the building and checking that they wait for 15 minutes and helping to observe people throughout that journey. Now, we would like to invite any patients of Avon Valley Practice or Sarum Health Group, and I'm clear they are patients of Avon Valley Practice or Sarum Health Group, through into helping us next weekend to be able to help us to do that. And we've actually put a volunteer agreement on our website. So I'm just going to ask Stuart to show the Avon Valley website first, if that's okay, Stuart. And I'm just going to guide you through where that volunteer agreement is, and you can take a look at it. So this is the Avon Valley website. Now, if you go to practice information, so that's on the left-hand side to the middle, there we are, then Stuart's just made it go blue. press that button. You will have here patient involvement, and in the middle box, you've got COVID-19 vaccinations volunteer agreement form. So if Stuart now clicks that form for me. Okay, we've now got a volunteer agreement form. So if you would like to help out with the volunteering with us, please can you complete this information, and we will process that to be able to perhaps accept you to join us. Now, I only say perhaps, not because I'm worried of any way, it's more because I'm expecting lots of you to volunteer, because you have been so supportive of what we've been doing and how we've been getting on, that actually I kind of expect that a lot of you just really do want to help us out and be part of this brilliant programme. So we've got this volunteer agreement now live, and Stuart, if you can just move over to Sarum Health Group as well, so that people can see that. So that's Avon Valley, but indeed it's exactly the same place in Sarum Health Group. So again, Stuart's going to go through that, and I'm just going to recap. So practice information, and then on this time it's in the patient participation group, and we've got COVID-19 vaccines. Yep, click that button, and it'll come up in a minute. Here we are, and the form is exactly the same. Okay, now these forms are sent to the dashboard to our office teams in both practices. They will check that you are a patient. Okay, they will be checking that, and if so, we'll be passing your forms to Helen, and I'd like Stuart to show you Helen on camera, because she's head of volunteering. It's a new role for her, so you can give us a wave. So let's just see her in a minute. I'm just waiting for the screen to go again. Here we are. Here's Helen. Right, cool. That took a little bit longer than we were hoping for. So Helen was on camera thinking, what on earth was going on? So that's Helen. So Helen has a new role with us. I'm head of volunteering. So she's collating all of your applications to become a volunteer, and then allocating you a shift. Now, please don't be disappointed if we don't get in touch with you. You will stay on our books, and we'll do our very best to enable all of you to volunteer, because that would be ideal. However, we are capped at 20 people a time. So if we get inundated, which I really, I do anticipate that, like I said, I think you're great, and I know how supportive you are, but we will do what we can to get as many of you to volunteer and to be part of this programme as you want to. But please don't feel that you have to. If you don't want to, don't worry. We understand that, but it's just there in case you'd like to do that. Then you have the methods of which to join in on this programme. Now, just to recap on the stations, there are stations with us in terms of this, where you've got station 1, 3, 5, 4, 5, 6 and 7. So please make sure you read that information clearly, so that we understand which station you feel able to help us with, because they do all require different levels of stamina, different skills to be able to undertake the roles that we need. So all the information is there on our website, and by all means get ahead and start joining in and start filling out those agreements. Please, we will only accept those that are fully completed, only because we just don't really have capacity to go and chase people when there's things missing. And I mean that in the most respectful way. It's been quite, it's operationally very heavy at the moment to make sure that everything is spot on and just right for tomorrow. So let me just look at some questions. Will you be moving to 24/7 vaccinations? If we were given the vaccine, then yeah, I can't see why not. We have to obviously maintain safety of all of our staff. So as long as we get support for staffing, because remember, we still have the contracts to deliver your primary care on a Monday to Friday basis, 8 to 6:30. But that's what we've got to do. So if we did, but mainly this is a vaccine supply issue. I need to repeat that quite clearly, because I think patients have wondered why it's taken longer for us to start. actually, it hasn't taken us longer to start. Salisbury City practices go live this weekend as well. Indeed, Sarum, people out in Wilton and far to the west, they went live this week as well. So we're all pretty much the same, but we are all capped at what we are delivered by NHS England. They are the ones that set the schedules. And as much as I'd like to be able to order what, when and how, we can't do that. So we are at their peril, okay? But what I promise you is that as we get that vaccine, we will deliver that vaccine. Now, to reassure you all, is that we also have to make sure that all of our community is safe. So if we have vaccinated everybody, and indeed we have a few extra cohorts of people that are, in cohort 1 and cohort 2 that live perhaps nearby, then we will offer that vaccine to those people too, because actually that's what we should be doing and working together. Okay, so we will be working with our other practices, with our other local communities, because we've got to do this together. But be reassured, we have enough vaccine for all of our cohorts. Okay, I promise you that. Will you call NHS staff for a vaccine at the end of your session if you have any left? So I said at the part of that was that on Sunday I have people already on standby to receive calls from me. Should we have vaccine left? They are all health and care workers, all part of the military. So we know who they are. I've got the phone numbers of those people and I'll be ringing them up, asking them to rally the troops and bring them in to be vaccinated. So somebody said, my mother is getting her jab on Sunday. She gets confused a bit. Am I able to come in with her? So we are hoping that yes, but we are advising as many people as we can to wait in their cars rather than to accompany patients through because of social distancing. We do not have enough chairs in the waiting room for you, but we also understand best interest and mental capacity, and therefore we will, look at every individual as a one-to-one individual care plan. Okay. So somebody said, I haven't had a letter today, I'm housebound and so need to wait for a home visit. Yeah, unfortunately, like I said, we've got an issue with AstraZeneca. My son, who is also clinically extremely vulnerable, is not housebound. Can we ask that he's given his at the same time as me at home? Well, bearing in mind that we have an AstraZeneca issue right now, your son should be receiving a letter to be vaccinated next weekend. So I wouldn't wait and delay the vaccine for your son in terms of this. Have him to be vaccinated, and as soon as we've got the issues with AstraZeneca sorted, then we can look to vaccinate you. I think I've answered all these questions. I'm just trying to go through them and get an idea of what's happened. Oh, so somebody just said, I've arrived a little late. Can you advise when the clinically extremely vulnerable should receive their appointment? So the letters have gone out. They went out yesterday evening. So I'm expecting you to receive them from today through to Monday. Now, some people have confirmed that they've received it already, but please be aware that we just need to give snail mail a little bit of time to get to you, and please contact us, preferably by the website, if you haven't received a letter, so we can confirm the time of your appointment. So now somebody else said, can we offer vaccines in the car park if weather permits? No, it is an absolute no-no. NHS England do not permit anybody to be vaccinated in cars. They must be vaccinated inside premises and they must wait for 15 minutes. So that is a no-go. There will not be anything in the cars. Okay, let's have a look now. We're getting to the end. I can see that we are at 6:10. I'm hoping that I'm sure I've answered all your questions, and I'm really sorry. I had 44 in, and we've got some new ones. Oh, hang on a minute. I'm just getting some more in here to be able to do that. So hang on a minute. We've got some questions here that I'm going to have to look at that hadn't been published. So I wasn't looking at those. I'm really sorry. Now, are MS people classed in the at-risk group? Again, recap on the clinically extremely vulnerable group. We need to go through that. I'm not a clinician. I do know the different groups, but I can't comment on individual cases. That's not really my role here. I'm so sorry. It's not to be not helpful, but it kind of is outside of my limitations. Have to be able to do that. Please, can you give us your web address? So we did show that on the screen. I'm hoping that's okay, but I'll get the team to just message that back to you so that everybody can see it. Again, web address, we did show that, so you've got those two, but I'd like that to be published and updated, please, as well, to be able to do that. I thought as a 50-year-old I'm cohort 9. If you go through the numbers, I just checked them. 1, 2, 3, 4, 5, 6, 7, 8, 9. So you are in cohort 9. That is correct. So you're 66. So 66, let's check the numbers again. 1, 2, 3, 4. So you are in cohort 5. So 66-year-olds are in cohort 5. We haven't been told what the government agenda is to vaccinate people in cohort 5. We've just been told that it is 1 to 4. That's the target by the end of February, and we will be, hopefully, if our vaccine continues to come on a weekly basis, be vaccinating you all, hopefully beginning of February. But we are dependent on that vaccine being delivered to us. Is it possible to load up the web event before the weekend? Now, I'm going to ask Stuart that. Can we upload this video link before the weekend now? Nod or say no, I don't know. Nod or say...
We can, we can upload it as soon as we're finished, as long as we don't want to make any changes to it.
No, well, we don't make any changes to it, so that's fine. Okay, so yeah, we'll do that at the end of this meeting. Okay. So other practices, I can't comment on that. I don't know their numbers, so I can't really say what other people are doing locally, but I do know and can reassure you that you've got the correct information from us. So somebody says, if you press the mute button, cannot hear you. So I'm not aware I'm on mute. No, I'm not on mute. So if you can turn the volume up on your computer, that would be great to be able to do that. I cannot hear or see any answers or information. I can only see the questions. What can I do to access information? I'm not too sure what you mean, can't hear. Again, I think you might have to look at the volume setting on your computer because all of our systems are okay here and should be working, and I'm getting lots of nods. My mother's appointment for this Sunday has been cancelled, but we have been promised another one for the 22nd. I don't know who promised you that. I'll be absolutely honest, because that wasn't directed by me. Now, we have a very set agenda for how we are re-inviting people in, okay, to be able to do that. So I can't make a promise. I'm doing my very, very best, okay, and we will be contacting people, all of them who have missed their appointments in from this weekend, to re-invite. But we don't know who you all are. We need to understand the numbers, and we needed to still get the vaccine letters out to other people in cohort 2 and the clinically extremely vulnerable. So we will do all that we can, but please just bear with us to be able to see what's going on. But nobody should have promised that to you. I don't like making a promise that I can't guarantee that we can keep. So I don't know the contents of that. So yeah, as Helen's asked, if you can give us your details, then we can investigate. Why do you have to wait 15 minutes? So we went through that last week as well. You need to wait for 15 minutes because that is the safety requirement for vaccinating. Okay, and when you are vaccinated, the clinician asks you, will you agree to wait for 15 minutes? And if you say no, they will not vaccinate you. Now, you are required to wait because you may have a reaction to this vaccine within the 15 minutes time. That's the most likely period of which you may have an allergic reaction. So you need to stay with us. Now, that's why also we said last week, please don't try and go to the toilet with us. If you can go to the toilet before you arrive, that would be brilliant because the toilets are at the exit. But equally, when you're waiting in that 15 minutes, we cannot observe you in the waiting in the toilet. Now, if anything happens to you in the toilet, you have a reaction of any sort, you may not get medical care as quickly as you need. So we do need you to stay visible and with us during that period of time. Okay. I think I've answered all those ones that have just come in. So anyway, I think I've done all of those now. How I thought I'd almost finished them before. So we've had loads of questions today. I think we've had over 60. So hopefully we are in there and sorting them with you, and you understand kind of what we're doing for this weekend and the plan for next weekend, and we can move forward. But thank you so much again for all your support. Thank you for taking the time to listen in on this meeting, because I think it's invaluable to find out kind of what the flow is and get reassurance about what is happening and what we're doing. It's a community event as we see it, and we're privileged to be able to deliver this programme to you. So if you have got your vaccine appointment tomorrow or Sunday, good luck. You will see me. I'm in a black tabard tomorrow, so do say hi. I'll have a face mask on, so you know, bear with me, but yeah, we'll be able to meet each other, and we can go forward for that. So hopefully it's a good experience for you. Everybody is very keen and willing for this to work, and it will be safe, and yeah, all to a brighter future. So take care. Hopefully we'll meet again probably next week if I know when another delivery is coming, okay, to update you so I can tell you about what's happening with the next cohorts and what we are doing and how we are doing it. So have a good weekend, take care, and yeah, I'll see you again. Bye.